of those recommendations. And you also have there at your place the schedule of some of the fall classes we have coming up. We have some great ones on cancer care. We have, of course, our monthly class called Food is Medicine, which is a free class that is a wonderful foundation to understanding nutrition in the context of the modern world. And then I don't think it's on the list, but also coming up this fall, we have a really neat class on chocolate. And it's not only going to be the health benefits of chocolate, but it's going to be a tasting, which is so phenomenal. So look for that. That's going to be coming up here in November. It's just an excuse for me to eat chocolate. I mean, really, these classes are really just an excuse for me to learn more, if we're going to be honest. And so I always love bringing in people that I want to learn more from. So without further ado, I'm going to introduce, or I'm going to hand the mic over here to Dr. Fetzik, and he'll introduce himself.
Okay, thank you. Thank you, Ann. Well, I'm Dr. Stephen Fetzik. I'm a dentist here in Wichita. Can everybody hear me good? Okay. And I have a passion for helping people with this procedure, the tongue tie, lip tie, as well as other procedures. But today we're going to be limited to this. And I brought a body worker from my office, Katrina Patrick. She's going to be talking some about some breastfeeding issues and fascia therapy as well, and some more. I'm just going to let her speak, talk about whatever she wants. So Ann and I have been talking, and this is a procedure that I wanted to come out and share with you guys. It's a fascinating procedure because these ties since the 90s. And then back in the 90s, I didn't have a laser, so we used, scissors or scalpel, and I had to use sutures and all that. But I didn't know the significance of the tie as far as a whole body restriction at that time. I wasn't into the whole body work thing like I am now. I mean, I have body workers in my office, and we're using chiropractors, lactation consultants. We have an oral malfunctional therapist in our office. So, we've got a whole team that we're using, when we do this procedure, because it's not just one little snip and clip and you're done. And everybody's different, especially when we get into adults. Some adults require more body work to heal. And so, but it's been a fascinating journey. I'm still learning. And we've had some really great results, and we want to share that today. I wanted to start off with a few questions to ask you guys. Has any of y'all ever had difficulty swallowing or speech issues or even mouth breathing? If you answer yes to any of those, you might have a tongue tie. And so, those are just some of the symptoms that we're dealing with. It's a very underdiagnosed problem because physicians and dentists were not really taught this in medical and dental school. I know I wasn't taught any on this procedure. And so this was all continuing education, learning after my degree. I'm going to give you a little bit of history here. It's one of the oldest procedures that we still do today. Back in the 1600s, midwives, they couldn't use instruments, and they would keep a sharp fingernail, and if a baby had a tongue tie, they would release it right there. And they had to do that because, they weren't allowed to use an instrument. But I thought that was kind of interesting. It's kind of a crude way of doing it, but I guess they had to do what they had to do back then. But what it shows us is, the procedure's been around and people have known about it for a long time. And then we got away from breastfeeding during the modern, industrial revolution. We're using formula more and bottles. And then in the 90s, we realized, breastfeeding is really better for the baby, in a lot of ways, from the the initial antibiotics they're getting to the whole suck, swallow is part of their development. And so at that time, that's when, we started looking at this more because mothers were having trouble breastfeeding, and, we had to figure out what's going on, and then we realized, babies are tied or tongue-tied or lip-tied and things like that. So that's when we got a little more traction for this to take off. So this is a definition of the tongue tie from a group I belong to, the International Affiliation of Tongue Tie Professionals. It's a mouthful. But it says it's an embryological remnant of tissue in the midline between the undersurface of the tongue and the floor of the mouth that restricts normal tongue movement. So the key word is restrict. That's what we're looking for when I'm looking to diagnose these ties. And so, like in this picture here, we're seeing a pretty good pull at the tip of the tongue here. And when we see that crease right there, we know that's a tie. That's holding that tongue to the floor of the mouth. So this is what we call an anterior tongue tie. But this person's probably also got what we call a posterior tie, which is right in this area. This is a pretty thick, wide band of tissue here. And you can see that tension there. And when we're doing these procedures, like Katrina's with me or Carrie, and they'll actually feel that release of when we release that tie, that tension. Sometimes it even pops. It's that much tension in there, and so it's amazing, that it's that much. Now the third area is down here behind the teeth. We call this an alveolar area, and you could have a tie down there too. Sometimes that goes away when I eliminate these two here, but sometimes not. So there's 3 different areas under the tongue that I'm looking for restrictions. This is something that we get a lot from parents that come in with their babies, and it could be adults too, but they've seen their primary care physician, and they're asking their primary care physician, hey, does my baby have a tie? I'm having difficulty nursing, and the doc says, no, you don't, and then they share their opinion that I think this is a fad. This is just something they're trying to make money on. They don't believe in it. And so, of course, I disagree with that because, like I'm gonna relate this to like autism, like the diagnosis of autism has increased so much since the year 2000, and it's largely due to awareness and the signs and symptoms. Well, the same thing with tongue tie. We're more aware now of what to look for, and unless you've had some training and understand it, you don't get it. I used to not get it, until I got more training. So the diagnosis is similar. We also have so much out there, social media is huge. We have the Kansas Tongue Tie Group. These new moms can get on there. They're asking other moms, questions or listening to their stories, or they need to find out who to go to. And so that's increased, people's awareness and getting them into the right places. The whole tongue tie thing is certainly hereditary or genetic. This is a typical scenario in our office. A family comes in and they bring their baby, and they're having nursing issues, and we check them. Sure enough, they're tongue-tied or lip-tied or both. And then the parents realize, hey, I want you to check my 3-year-old and my 6-year-old. Do they have a tie? We check them. Sure enough, they've got it. And then one of the parents starts putting this together and go, you know what? I have some of those symptoms too. I want you to check me. And most of the time, one of the parents is tongue-tied. And so there's a genetic thing going on there. And the parents get it, and we explain that to them. The other thing going on is, our environment. We've got our environment and our diet. We've got things called, the buzzword is epigenetic changes. And what that means, it's our environment affects genetic expression. And here's some examples of what I mean by that. A lot of kids now, they're playing video games, they're inside watching TV, they're not outside running around playing barefooted, so they're not getting grounded. And so I hear Katrina all the time talking to these parents. You need to get your kids out there playing outside. Take their shoes off, get them grounded. That's something that can help them with this, dealing with their environment right now, because we know too much blue light is a problem, and it can affect sleep for one. The other thing going on is, we got chemicals like this glyphosate, which is in Roundup. So you've probably seen the Roundup. Monsanto got sued again. This is like the third time for Roundup because of health problems. And so, these toxins, that affects this genetic expression. So all this leads to, increases in autism, diabetes, cancer, autoimmune issues, and tongue ties. So that just gives you a little bit of a background to start why the increased prevalence. The next thing we're going to do is implications as to why we get the tie. So the tie is a result of a lack of apoptosis, which is cell death, that removes the frenum under the tongue. We see that in other areas of the body, you can have kind of web fingers, and that web's supposed to have cell death, and you lose that. Well, sometimes it doesn't. So we see that in the mouth with the tongue as well. The variations in this apoptosis can occur. We can get partial, cell death, and the frenum, may be still connected too high on the gum or the surface of the tongue, or may not be as stretchy or elastic as it should be. So, even though some of it may be occurring, it may not be enough. Vitamin A is also known to activate the genes that involve in skin apoptosis. That's another supplement there that we need. And then the third thing, this MTHFR mutation, this is an enzyme used to convert folate into methylfolate. This has been also connected with tongue ties. Let's talk about that a minute. This enzyme deals with methylation, or the way the body processes toxins and repairs DNA. Variations in the mutations in the gene encoding the enzyme have been associated with midline defects. So midline defects can be a lot of different things. We get cleft palate, cleft lip, congenital heart issues, spina bifida, sacral dimples, tongue ties, and I'm sure there's more. I'm probably not even including everything. And then in 1992, mothers were encouraged to take folic acid to reduce this incidence of a neural tube birth defect like spina bifida, and they were encouraged to take folic acid. Well, folic acid is more of a synthetic version, and it's not very well absorbed. And so, especially if a mother has reduced MTHFR activity, they cannot change that folic acid into folate. So folate is what you need, or methylfolate. And so one of the things we encourage mothers is you need to be on that, not folic acid. And so the body can absorb that, and get into the system better. So as you can see, things like folate, methylation, MTHFR, those are all in this discussion about tongue ties and why we have them, why we have increased prevalence of them. Let's see. The lip tie. So here's another definition of that. It's a failure of the upper lip to flange outward, normally due to the restriction of the lip from an attachment of the lip inserting into the gingiva. So we've got to have that lip to kind of come up and out in babies to breastfeed. We also need that lip to be free for the upper jaw to grow, in children, even adults. When we're removing teeth, that tie can restrict the upper jaw from forward growth. And so, it can be thick, like this one here. That's a pretty wide band of tissue there, and it comes all the way down into here. So we classify these, and this would at least a class 3, probably a class 4 going here. And these fibers can actually keep these teeth from coming together. And so from an orthodontic point, we got to eliminate that to get the teeth to come together. But there's so much pull here, we'll see the babies, they get a big blister right up here when they go to breastfeed because they can't get the lip to flange, and then they're causing the mom pain, and they're not transferring milk, and on. So we've got to, in this scenario, this person would need a lip tie frenectomy. Here's some signs and symptoms of tongue and lip tie. We talked about a couple right off the bat here. These two, narrow palate. We see that a lot. You chiropractors probably see that a lot, right? We see it in our office. Sleep apnea, reflux, and colic. Katrina deals with that all the time. TMJ. When I got into this, I didn't think you could diagnose or start seeing TMJ problems with a baby, but you can. And I never knew that. Oral structural development. This is what I was talking about a while ago with this forward growth, how the ties can prevent that and keep our jaws back, and our lower jaw may be protruded. And so that can affect a lot of things, including the airway and sleep apnea. Earaches. If your tongue's tied and it can't get to the roof of your mouth, you can't swallow properly. And if you can't swallow properly, you're not clearing the fluid out of the eustachian tube. And so we tend to, have more ear problems there. That's why kids are have to get tubes in their ears. So one of the things you chiropractors tell us is that, hey, doc, once you did that release, I noticed, the patient's holding their adjustment a lot better. The patient's telling us, I might sleep better, or if they have migraines, they're saying, you know what, my migraines have really subsided, and instead of one every day or every other day, I may only have one a month, or I may not have them at all. And so this is kind of feedback we're getting from our patients after this procedure. Okay, the hyoid bone. That's right here is this hyoid bone. And what we see is in adults and children, when you're tongue-tied, these muscles of this here feed in and insert in this area, and it keeps this bone up high under your jaw. And that's one of the reasons you have difficulty swallowing, or it's putting a lot of tension back here in this occipital area. So we're getting headaches. That's why we're having trouble with holding adjustments. And then it's affecting the whole body. So when we release that, this bone is able to come down or inferior more and take a lot of tension off this area. And it opens the airway here as well. And so we even do a little hyoid adjustment. You know, we kind of wiggle it here like this and loosen it up after the procedure. We want to free that because it's been usually tight in there, and so that really helps the patient out. And these, you know, physical therapists, chiropractors that, you know, are treating these people prior, they're shocked at the difference, you know, and then all of a sudden they become believers in what we're doing, especially if they're new to this. The patient's also telling us that, you know, hey, I feel less anxious now after this procedure. So they, you know, it could be, you know, it's calming their nervous system a little bit is what we think, and releasing this tension. Let's see. The procedure it's really a low risk procedure. There's soreness for a few days. Like I was sharing with somebody a while ago, I had it done on myself. You know, I took some ibuprofen after the numbing wore off. Then I didn't take anything else after that. I was eating like normal that night. It didn't really bother me. I had some soreness and I was doing stretches and things like that, but it's a really, you know, low risk procedure. Now I know adults, everybody's different, and you know, some people have a little more, it takes them longer to heal, or they may have a little more post-op issues. But that's, you know, anything we do, everybody has a different threshold they're dealing with. Let's see. This is a poster we have in our office. I'm not sure who did this, but it's a dissected tongue showing the connective tissue fibers and fascia from the tongue, and how it, when they dissected it out, it goes all the way down into the, you know, abdomen, sacral area, all the way to the feet. And so I didn't know that, you know, when I got into this, but it explains why some patients tell me, hey, after you did that release, I really feel better in my, you know, in my hips, or you know what, my feet feel better. And then you body workers tell me, you know, hey, you know, I was able to adjust their hips better, you know, finally, or it wasn't so hard. And so sometimes they feel it right away, right after I do the procedure. And so that's been interesting there. This is, of course, being a dentist, I got to show you an x-ray. This is a patient in our practice. She came in, she was almost around age 13, and she had 4 premolars removed and what we call retractive orthodontics. And what that means, they take 4 teeth out and they bring your front teeth back. And that used to be the standard of care. Unfortunately, some of that's still being done today. But we don't like to see that, because when you do that, it's gonna bring the tongue back and the jaw back on that airway, and you're gonna have a smaller airway. And so, you know, now that we're learning more about sleep apnea and the causes of it, well, that can be a cause right there. And so, she had issues, you know, symptoms with, you know, some headaches, swallowing. You know, you can see that. This is the airway she presented with here, really small. Look at their cervical vertebra. This is straight, or what we call a military neck. We want a curve in there, and then her jaw's tucked back and down, and yeah, right. She's trying to survive, and so you know, her autonomic nervous system was, you know, ramped up. She's more in sympathetic. She wasn't, you know, this fight or flight type mode. And so we did the tongue tie release. She and her mom were on board with everything. So that made this go easier, because, you know, they were up for body work. You know, we had chiropractors adjusting. We had fascia work. You know, Carrie and Katrina worked on her. You know, and from I guess it's a slow process here, but earlier this year we took this film and, we're seeing her airway open up, her jaw's growing more forward now, and she feels better. She's getting a little bit of a curve now in her cervical vertebra. And so she feels better. She's less anxious. She's easier to work on. She didn't like me to touch her when she came in. It took a while for that to go away because her nervous system was so ramped up. So she's a lot better. And then her mom, shares with us. She goes, "Hey, Doc, we really feel like you saved our daughter's life here." And that was really touching for me. And when you think about it, in a way, you are, because, this person can breathe better. They can have a better life. And so these are the kind of things that keep us doing what we're doing, those strokes that know that we're doing good out there. And so it's a real feel-good moment for all of us, for the patient especially. This is a little educational model we have in the office, and it's just showing about the airway, and how when the tongue here is back, or the jaw's back, how that airway decreases. And if we can get the tongue to come forward with the jaw, we can open up the airway. And so we want to get the tip of the tongue up here. We call it the spot. The middle of the tongue, we want it to touch up here in the palate. And when you swallow, I wish we had a video, but we want that tongue up there going back, kind of suction up into the palate. And that's how you're going to release that fluid from your eustachian tubes back here too. But it promotes that, forward growth of the maxilla and all. And so this is one of our goals when we're trying to, either children or adults, is to get them, more forward. And typically what has happened with our modern diet, we don't chew as much, and our jaws just aren't growing like they used to. They're shrinking, in fact. And so we're seeing now, we've got to get people chewing more. Like Katrina may give these kids, when they're a year and a half, a little thing called a mild munchie. Basically, it's like a chew toy, and we want them chewing in it, bouncing on the ball, chewing it, and it'll stimulate, actually some expansion in their jaws, because, they're out there eating, soft diet like macaroni and cheese, or, just anything soft like that, and they're not chewing enough. And we want them chewing. This is what Katrina sees a lot of times in the office. The first look at, these kids coming in, and this kid's trying to tell us something's wrong, right? So, we've been amazed at how quickly these kids can turn around when we can get in there and do releases. They can get body work, fascial work, proper lactation care, and they can, they get a lot happier. She's going to talk more about that, but these babies will come in, and that some of them can't even open their hands. They're like clenched all the time. And I never realized it was that powerful, that, some of these, how their nervous system can be. And it could be from a lot of things. I'll let her get into that. But it's been rewarding, to do this. I never thought I'd be working on babies when I went through dental school, and now it's one of the favorite things I do. And having body workers in my office like Katrina, that really gives me a lot of insight into what's going on during the procedure, and that helps me. And that's one of the advantages we have in our office that I enjoy. So I'm going to let Katrina come up and talk on breastfeeding, fascia. She may have growth and development, all kinds of things. All right. And then we'll have some Q&A here as soon as she's done with this.
you hear me? Okay. If I never saw a tongue tie again, I would be so happy. This has just rocked our world. Every single day I have moms come in and they're just desperate. I mean, there hasn't been a lot of help for them, and there's just really nothing worse than when you can't feed your baby or if your baby's crying all the time. So I always encourage everyone to go to Kansas Tongue Tie Group. It's just a wealth of information. It's a good support system. So usually when mom comes in, she's upset. She's having breastfeeding issues. She's in pain, bleeding nipples, reflux, gas, you name it. One of the signs, when they come in is I'll do an intake. And the first thing I'm going to ask is how are they doing with postpartum? Because this is a process. And when you release a baby, there's a lot of crying. It's, you're going to be doing exercises 5 times a day for 5 weeks. So mom really does need to be in a good place. So sometimes we have to treat the mom first. And I always, from month 1 through 3, I feel it's the 4th trimester. So I treat the mom and the baby as one. So one of the things that we're looking for is when they come in is, how is their latch? You want to make sure that they're getting a good section. Are they transferring, gaining weight? I see a lot of failure to thrive babies. Babies constantly feeding all day. Well, then if they're feeding all day, they're expending all that energy and they're not gaining weight. So they're working so hard, and it's kind of like eating a cheeseburger on a treadmill. You're just not going to get anywhere. Falls asleep while nursing. Reflux, that's a big one. When a baby is tongue-tied, there's a couple different degrees. If this is your tongue, you're going to be anterior-tied or posterior-tied. So your tongue should lift and on the second swallow and do this. Your tongue is a natural shaper of the palate. So if your tongue is not in the palate, your palate will continue to grow up. And then you get the vaulted palate. So later on down the road, you're going to have speech, food handling, and all that stuff. So you want that tongue up. And if it's not doing this, you're chomping at the breast. So when you're chomping at the breast, you're getting air, milk. Then you're getting reflux and gas. The other thing, colic. I'm always addressing the diet as well as the tongue tie. A lot of babies nowadays, they can't digest the proteins in the milk and the caseins. So we're always looking for that thick saliva, that ropey saliva. That's a good indicator. And also we want to keep the inflammatory response down when we're, releasing these babies. If these babies are, inflamed, then their healing is not going to be optimal at all. You're going to get scar tissue. So you're always asking those types of questions too. Snoring, heavy breathing. I think we had a slide earlier, with the posterior tongue tie, when the babies are leaning back and sleeping, that tongue is blocking the airway. So you're snoring, just trying to breathe, trying to reposition everything in the mouth so that you can breathe. And choking, that's another big one. Mom has a strong letdown. That baby cannot keep up with that letdown. So he'll be choking and gagging at the breast, just trying to keep up with the flow. But if the structure's not right, then the baby can't keep up with the flow. Okay, so then reflex with the tongue tie and lip tie. Again, you have to have a good seal. Some people are kind of on the fence about buccal ties, and those are in the cheek. Anytime I see leaking milk coming out of the mouth when they're feeding, there's usually a buccal tie. And then chomping at the breast while nursing, you're going to get that air intake. Again, you got to have your people in place. You got to have your lactation consultant, your chiropractors, your body workers, someone that knows about how to release a tie. Okay, well, releasing a tie will help with the structure immediately in feeding. You're going to get immediate results whenever you release a baby, but then you've got to break habits. And so that's why you have to have your chiropractor, your body worker, and a lot of times with these babies, I'll see their belly button will be just sticking out an inch. That tongue tie is pulling their head forward. It's, tight in the belly. They're in sympathetic mode. So you have to have your people in place. So our goal is to get the baby in parasympathetic mode. And to do that, you've got to release the tongue. You've got to get them feeding. You've got to get the chiropractor involved so that we have a good outcome. Fascia. Fascia is covered from head to toe, your whole body. It's the white, sticky webbing in your body. If you have restrictions from like a tongue tie or anywhere, it sets up like concrete. So body work will go in there and manipulate with the fascia and do body work. Okay, so sleep apnea. So many things with sleep apnea. When you're not breathing right, you're not functioning right. So when your tongue's not in the proper place, you're not functioning right. We see a lot of attention disorders in schools from mouth breathing. A lot of times kids will come in, I think my kid has ADD, and there's so many behavioral issues. A lot of times that's going to be mouth breathing and things like that. Cardiovascular, metabolic complications. Let's see. And poor academic achievement. A lot of times these kids, they're just in sympathetic mode when they're in school. They don't know how to control their emotions. They don't know what's wrong. They're tied, they're breathing through their mouth. They're not aligned. So that's another thing that we're looking at when we're asking these questions when these kids are coming in. Okay, potential problems when you don't release. One of the big things with lip ties is when you have a strong lip tie, you trap food and milk and debris, and you get surface decay. Of course, the space between the front two teeth, that's another indication of a lip tie. Hinders growth of jaw. You want that forward face development. When you're lip tied and tongue tied, you're really retruded back, and that does hinder forward face development. And sometimes what you'll see is downward growth. And Dr. Fetzik had mentioned earlier about, they used to take those molars out and retract back. Well, when you do that, you're closing your airway. And so that's another reason people will have anxiety because they can't breathe. And crowding of teeth. Again, the tongue needs to be in the palate. If the tongue's not in the palate, that palate will start to volt and you'll get crowding of teeth. You got to get that tongue in the palate. Speech issues. I work with so many speech language pathologists now. That's a huge thing. A lot of them are coming in, they're saying, we have done everything that we can do. We cannot get that tongue up there. They cannot do this, they cannot do that. Well, when we fix the structure, it's a different ball game. They're getting a lot of movement, eating. I had a speech language pathologist a couple of Mondays ago. She came in and just watched us. And she's actually a myofunctional therapist now. And taking that course has really filled in the gap for her. And now she kind of sees what she needs to do. So we're seeing a lot more speech language pathologists refer for tongue ties. Food handling issues. A lot of times kids will pouch food in their cheeks. They're choking. They're moving food around but not swallowing or spitting it out. All because of the tongue. And sleeping disorders. I mean, if they don't have that tongue up, it's going to be in the back of the throat. So we have a lot of sleeping disorders, even as adults now. People who haven't resolved those issues, now they're, in their 50s and 60s, and they're on CPAP machines. And so we see a lot of that, and some of them we do release after they go through myofunctional therapy. And then happy baby afterwards. Okay, I guess we'll just ask questions in. We've got about 20 minutes. Hi.
Question.
Mm-hmm.
Have you had a baby that has hearing difficulty that's related to tongue tie? Not passing initial screening tests, those kind of things?
I have. Yeah, repeat the question. Okay, so what she's asking is, have I had children come in, or babies in specific, she's an IBCLC, who are failing their hearing test? And the answer is yes, all the time. I have had several babies come in who have failed that hearing test, and with body work and releasing the tongue, within a couple of weeks I'll have them retested and they'll pass it. So we see that all the time. Every once in a while there's one that there's an issue, but I see that a lot.
Yes, Dr. Fetzik. So have you noticed or have you seen a correlation between having these revisions and the adenoids and tonsils shrinking?
Yes. The key is getting them to nasal breathe, and if we can do that, we can shrink those, especially the adenoids, and we're also looking at shrinking the tonsils too.
When you're a mouth breather, your tongue gets bigger, your adenoids, your tonsils. Yeah. So that's one of the things that we do at Fetzik Dentistry is restorative breathing.
Yeah. You're welcome.
So, because I know you do adults as well and teenagers, if they've already received orthodontic care from another dentist, and like your one patient that you have, and they've had molars removed, and it's moved the jaw back, and it's obstructing airways or whatever the repercussions of that were, what do you do for that, and how do you help them with that so that after the release they're not moving back again, since they don't have their molars there? Do you know what I mean?
Well, one of the things, a lot of times, Dr. Fetzik will put that space back. He'll expand and put the space back for where the molars were removed. The other thing is you have to have myofunctional therapy. If we release someone without myofunctional therapy, their tongue is just flapping around. They don't know what to do. And that could just send them into a complete autonomic nervous system meltdown. So you have to have that strength. It's like PT for the mouth. Myofunctional therapy is definitely key for that.
Yeah, well, like the X-ray that I showed, we're trying to regain the space with her, and we're getting there. Yep.
I have two questions, really. One of them has to do with body work, and is that something that the myofunctional therapist does, or is there another type of professional involved with that?
Well, fortunately, in our office, our myofunctional therapist is a body worker as well. So we've done training all over the United States. So if you're seeing Carrie, you can get body work and myofunctional therapy.
Okay. My other question has to do with wisdom teeth, and I think it's pretty commonplace these days after teenagers finish their orthodontic process for that orthodontist to say, okay, while you're young, let's get those wisdom teeth out before they become problematic. And so does that, getting those wisdom teeth out, whether they are problematic or not, have the same effect in terms of taking out the teeth that were supposed to be there? Does that make sense? Like, does it have the same effect as the...
Like with the X-ray I showed. Not necessarily, but, if those wisdom teeth are coming in straight and they have the jaw to handle them, I'd say let's leave them in there. I had that happen this morning with a girl, and she, they came in straight, and I felt like, hey, let's leave them.
So more case by case based on their individual mouth.
Yeah.
Mm-hmm.
With newborn, I deal with them early on. If they have a pretty obvious tongue tie, we encourage moms to get in to see someone right away. But, if it's affecting breastfeeding, I always have questions about the timing of the release. Also, some midwives will clip tongue ties, probably we're just getting the anterior tie.
And I support that, just by the way, because if you have a newborn and your 100% anterior tie, if that midwife clips that anterior tie just to get that baby feeding, I think that's a great thing. We can fix the rest later, but let's get that baby to the breast right away.
Yeah, because some of them, they can't even latch initially.
Right.
So what do you do with them?
Well,
clip it. Okay.
If they clip it, yeah, and then they can come see us, and then we'll address the rest of it.
We had that happen this morning.
We did. Mm-hmm.
The midwife did the lip and not the tongue, and then we had to come in and do the tongue, and that kid had buccal ties. So, yeah. What happened today?
So is it common practice for you to check all your patients that come in?
For tongue ties?
Mm-hmm.
I do. I like to check them all. Some of them are interested, some of them are not.
Okay.
But I try. And when they come to like hygiene and cleanings, I like to go ahead and check them. Then the girls, they start nudging me. Doc, you're talking too much about tongue tie. So they get on to me.
I had another question. So how long would a typical revision take? And then also, is there local anesthetic and that type of thing?
For babies or adults?
I'm looking at like a 6 and 4-year-old.
Okay. Then they would get a local injection. 4 and 6-year-old is a difficult age for us. We've got anxiety involved. We don't want to ruin their dental experience, for one thing. So a lot of times at that age, we'll do nasal sedation, Versed, and just squirt it up the nose just to get them to relax, kind of forget the experience. But yeah, that's a difficult age.
And they do get local anesthetic too. Yep.
Thank you. What if I wanted to be a patient and transfer my records and just start off with the teeth cleaning? Do you, like most dentists, swing in to do a quick exam after a teeth cleaning?
Yes.
Okay.
Yeah. Now, if we start initially talking about the tongue tie, so I'll just use you as an example. You're an adult. Then we'll say, we can continue this further, but Carrie and I do a separate, exam for that. And then she gets into a lot more intake and clinical exam and talking with you. And so
yeah, if it's a cleaning, he's going to do a decay check and structurally, and just he'll look in there and say, okay, I see a need for you to come back for a tongue tie evaluation.
Okay.
So.
Are you a holistic dentist?
Yes. Mm-hmm. Yeah, we don't use any mercury in our office, or we don't use fluoride.
Right.
And then we use products that don't have any BPA in them, things like that. So, and then we do safe amalgam removals where.
Yes, that is a trick.
So
we have ionizers in the room even to collect any debris.
Nice.
And we usually, we're wanting a patient to either come see a Reardon clinic for some pre-op and post-op detox and supplementation, things like that. And then, because we want to emphasize the importance of that so you don't get sick getting these things out.
Yes, I know about that.
Yeah.
What is the rough price range for someone like myself with no insurance for the teeth?
Cleaning and exam?
Yes, and the tongue tie removal, if any.
I'm not sure. I know for, let's say, a baby, okay, it's $285 for the upper for if you did the lip and the buckles, and $285 for all the lower for revisions.
Oh, okay.
And then for cleaning, exam, x-rays, and don't quote me, but it's around $187 for that first visit.
Oh, thank you. That's perfect.
So,
thank you.
But the girls up front, you could call them. They're great. They will give you, an estimate on everything, what it would cost.
Thank you.
You're welcome.
We do have cards.
We got business cards. Anybody wants one? I think Ann took them.
There was a question.
Are there reasons, or do you see tongue and lip ties that, I hear a lot, we had our baby checked, the doctor said if the baby's nursing fine, it's not causing pain.
everything should be fine, maybe just get it checked out before they get braces? I know I was told that. Do you think there's reasons to look further? I mean, I'm seeing some reasons just hearing you talk about, like my daughter, for instance, high palate and ear infections, and it never caused us any pain or trouble nursing, but she's 5 now, and the light bulbs are starting to go off. So what do you recommend? Like, I work with a lot of moms and babies, and they're told we don't need to do anything further right now.
You know, the one thing that I see after doing this is no one listens to the mom anymore. And the mom, if they know there's a problem, there's a problem. And so that's the big thing. If your intuition is telling you there's a problem, then get it checked out. If you're talking about a patient or something, the first thing, get an IBCLC involved and make sure that they are feeding right. These doctors weren't trained to diagnose these ties. And it's not that they don't want to, they just don't know. And unless you take the initiative to continue your education and kind of evolve, then you will be stuck in that time period of not knowing anything. So I see every single day. That's true, yeah. We do.
You know, when the pediatrician says, oh, it's okay.
Mm-hmm.
See, the moms get it. And like even a close pediatric dentist friend of mine, that's how he got into it, because the moms, you know, saying there's something wrong, what can you do to help, you know? And so then he started getting into this and figured, this is a tongue tie issue. And realized he had a tongue tie.
There's more awareness than there used to be. It's getting better. And sometimes, everyone can see the anterior tie. It's so visible. It's the posterior tie. And you cannot visually diagnose a posterior tie. You have to get in there. You have to feel it. And do a complete exam. So if someone's on the internet and says, oh, that's a posterior tie, I really disagree with that. I think you need to get in there and feel around and look at the total baby or child and see what kind of restrictions they have. 5 years ago, the ties were thin. And even in the last 2 years, it's interesting because the lip ties are thicker and the tongue ties are thicker. We've had lip ties come in that are, cuspid to cuspid now. So I don't know what's causing that, but epigenetics. But
Can you speak a little bit about what you do for palate? I think I've heard of some tools that you guys use. Can you talk about that a little bit?
Well, we use, like you're talking about for expansion, one of them is called the ALF. It's a light force wire. We use that for expansion. That's usually our go-to, and it's really comfortable. It's also it's an osteopathic type appliance where it's moving some cranial bones, and so we like to have you go see some chiropractors that know how to do cranial adjusting. We have some in the room that know how to do this, so we send them there, and because we're trying to balance the face, the bones, things like that. So it's a really neat appliance.
If we have a second, I can speak a quick story. Both of my boys have had it done, and in my youngest, he had it done when he was 6 months old. And part of the reason for having it done, both of my boys spit up, but they were never colicky, and they were both 98th percentile, so they were obviously not failure to thrive babies, but they would spit up after every single meal. And so we had it done in Jackson when he was 6 months old. And I can't even explain. The reason we actually took him in was not for the spitting up, but it was because he started to get delayed in his milestones. And he was just really stiff with all of his movements, speaks to the fascial restrictions he had. And so we took him in, and he wasn't holding adjustments. That was the other thing. And so we took him in, and I can vividly remember during the release, he was screaming. I'm bawling in the back. And then all of a sudden he stopped, just stopped screaming immediately. And the procedure wasn't over. There was still a few more minutes. And then when Katrina brought him back, he was a completely different baby. He was soft all the way through his spine from like head to sacrum. Like he was just, even my husband, when he held him the first time, he was like, he's squishy, you know, and immediately started rolling over very smoothly, you know, started sitting up real easily. And so it wasn't just, and then of course he stopped spitting up, you know, with every meal that he was eating. And so, but I mean, we saw a complete change in him head to toe. So my other son had it done when he was 6. And so he already has some of the dental. So you were asking about like dental work down the road. We're now having to go back because he's got a severe underbite and he's got some cranial restrictions and some other things we're having to go back and try and fix. And he's definitely improving a whole lot faster now that he's had the tongue tie release, and we've been doing some dental work with Dr. Fetzik. But I mean, I can't speak enough about how big of a change, because I'm a chiropractor, and so structurally, it's like the changes of these kids before and after a release is just unbelievable. So if that helps, that's my story. And so we did have one more question about adults and TMJ and how tongue tie could play into that, and what you guys do for that.
Well, the like that one picture with the hyoid bone and keeping that up and there, and then pulling back here, that can cause some issues with the TMJ. But it's it's a lot of connective tissue and fascia strain. Also, if the jaw is back, like that one girl, she had her teeth pulled and shoved back, that's going to put a lot of strain on that joint and cause problems, usually with it popping out and clicking, popping, things like that. And so orthodontically, we want to bring the jaw forward, but in order to do that, a lot of times we've got to release a tie. That tie can hold us back.
The other thing that I see is when these kids come in, right when they open their mouth, their bottom 2 teeth are going inward. And that's because that tongue tie is pulling those teeth in.
Yeah.
And then I'll see the same thing with their top 2 teeth. Before I even get into the tongue or the lip, I'll look at those teeth.
Yeah.
So we see that a lot too.
Yeah, if those lower teeth are kind of curved in, you probably bet it's a tongue tie causing it.
Mm-hmm.
Yep.
Any other last questions? 2 more quick questions.
So looking at a person, front and back teeth, that's going to be with the regressed infants as well as the adult teeth?
Yeah, like some of the infants, they're born and their jaw is back a lot of times. And that's one of the things we see right often. They're choking, they having trouble.
That retreated chin is something I look for right away.
Yeah.
I'm always looking at the baby's profile first, just to see.
Yeah.
And then it'll transfer to the adult teeth to help get it fixed?
Right.
Right. It will restrict those teeth from coming in.
Yeah.
What do you tell parents and newborns about how long? I know there's probably not a typical, but how long do they need, like the fascial work and body therapies?
It's case by case. Some babies just need a couple of sessions. They ask me about that all the time. Well, how many chiropractors? How many? If I had a crystal ball, I just don't know. Every baby's different. Typically, when they come in, just a normal, easy release, we're going to have a session of body work at the beginning, 1 week, and then at 2 weeks. That's not always the case, though. And then I just let the chiropractors decide because they're the ones doing the work. I'm not going to speak for them.
What do you chiropractors think? How many visits usually?
Yeah. Yeah.
In our office, we see some for a long period of time, and sometimes we've had a patient that had to come once afterwards.
Right. And with body work, too, there's some babies I just do a couple of sessions, and then there's others, like Ann. I think I saw him quite a few times, so just depends how they do.
Did you say how long the procedure takes?
Less than 10 minutes. Mm-hmm.
Yep.
All right. Well, thank you guys so much. I'm sure they'll be willing to stick around and answer any other questions. So, but thank you guys so much for coming today.
Thank you. Thanks for having us.
Oh, business card.
Yes, I got business cards. I will have them out of the back. You guys see the relation between
think so.